Good evening, everyone. Just thinking it's gone very quiet, so we should probably start before we have a whole conversation on skin by ourselves. It's such a pleasure to have you all here tonight. To anyone who is new to our events, welcome to the Beauty Triangle, and to all of our regular faces, welcome back. It's been a few months since we did a talk like this, and it's amazing to have you all back here with us, so thank you for spending the evening here. I'm Francesca Oakham-White, and I'm the founder of the Beauty Triangle. So we are here tonight to discuss the psychology of skin, because I think we can all agree our complexions have an extraordinary effect on how we feel about ourselves, and whether it's scarring, acne, pigmentation, or perhaps the first signs of age, they can really have a detrimental effect. And I think it's important that we recognise that yet there are still some solutions that are very effective, not only at restoring our skin, but also our self-esteem. When we first started the Beauty Triangle about 4 years ago now, it was always with the intention of educating and empowering our audiences, and always importantly from a holistic standpoint. But it was also to connect you with the finest voices in well-being. So on that note, it gives me great pleasure to introduce our amazing panelists, starting with consultant, dermatologist, and author of the Skincare Bible, Dr. Anjali Marto, aesthetic doctor and founder of Adonia Clinic, Dr. Ifeoma Ejikemi, and also finally Body Myers, head of nutrition, and Lanesborough Health Club and Spa resident Olga Hamilton. And really our panelists are here tonight to debunk some of the most common skincare myths, as well as helping us to find easy, effective and efficacious solutions to sorting out our skin once and for all. A few quick things before we get started. Hopefully you found a programme either on your seat or it's been handed to you, so you'll find all the information you need to know about tonight's amazing panelists on that. There's also a referral card attached, so if you'd like us to connect you with anybody that you hear speak here tonight, you just have to put your name and your email, tick a box, and we will do the rest. We'll have a Q&A at the very end, so any questions that come to mind, please hold on to them if you can until then, and we will come to you. And then finally, we have an amazing goodie bag with treats from Epionce, PCA Skin, Advanced Skin Nutrition, and ELA. So your face will not forgive you if you leave without remembering that goodie bag. So please pick that up. Enough talking from me. I'm going to pass over to our amazing panelists. They're going to say a quick hello, and then we will get cracking with the conversation. So over to you, Anjali.
Perfect. Well, look, I mean, the intro was great, but I'm Dr. Anjali Marto, consultant dermatologist, spend a lot of time discussing acne, rosacea, pigmentation, particularly in clinic on a day-to-day basis. And hopefully that's a lot of what we'll be talking about tonight as well in our bit.
I think so.
Yeah.
Absolutely.
Hi everyone, I'm Dr. Ifeoma Ejikemi. I'm a medical consultant. I'm the founder of Adonia Medical Clinic, a hair and wellness clinic based in Maida Vale. We recently won Best Clinic in London and Best Clinic in the UK. I'm also a senior lecturer in aesthetic medicine, where we train different doctors in different specialties on aesthetic techniques.
Amazing, thank you. And finally, Olga.
Hi everyone, Olga Hamilton here. I'm a nutritional therapist, and I actually initially specialized in skin conditions. So today I'll be talking about what made me become a nutritional therapist, because it was a skin condition.
Perfect synergy. Thank you so much, all of you, for being here tonight. So starting with our first panelist, Dr. Anjali Marto, she explained she has, I don't know if you said this, over 15 years treating the skin?
I started in 2005 in my first derm job.
Oh wow, so we could even say over 20.
Yeah,
my goodness.
Up to.
And you look like a teenager, so I mean, you're doing incredibly well with your skin secrets. We're going to find them all out. But Anjali, maybe you can start by explaining what are the greatest skin concerns that you see having a real impact on patients' confidence?
So I think as a general rule, and probably this comes as no shock to anybody, but anything that is immediately visible.
Yeah.
So often skin conditions that affect the face are going to be an area where people immediately feel self-conscious about their appearance. And also there's a degree of stigma that comes across from that as well. So I guess the common things that immediately spring to mind are things like acne, rosacea, pigmentation. They're definitely the big ones, but then I don't think we should underestimate things like eczema and psoriasis. So all of these are things I would lump into what I would call chronic inflammatory skin disease. So skin conditions which have necessarily no cure, but they can be controlled, but they will be up and down. So you have good periods with your skin and bad periods with your skin, but the point is that often it affects the face or sometimes the hands, and those are the areas that people look at first.
You're so true, because if you had, say, acne on your sort of back or sort of shoulders, you can at least cover that up every day, can't you? And it's the things that you can't necessarily camouflage.
Yeah, and I think we live in a society, unfortunately, where we do judge people by those split seconds. The first minute we see them, what do we see? And your face, and you know, it's very clear when we look at data. When we meet somebody for the first time, we spend a lot of time looking at this triangle of one's face, so eyes and mouth. Anything that involves the facial skin, you're going to notice first. So I think it's the one thing that people feel most self-conscious about, but we notice in others as well, whether or not we want to.
You're so right. And I mean, what do you sort of see in, I suppose, clinic? Is it that it's the adolescents who struggle most with this? Is it in later life when actually you assume that your skin is going to be having righted itself eventually and then it sort of flares up? What age sort of suffers the most, would you say?
You know, it's a really tricky one. And the reason I say that is because I think whatever decade in life you're at, there's always going to be an issue. So if you look at being a teenager, you're already going through loads of hormonal changes, hormonal fluctuations. You're already self-conscious about who you are and your personality is developing.
So true.
And then 80 to 90% of teenagers are going to get acne. And it's a right, you know, we say it's a rite of passage. But if you were a teenager who didn't have trouble with your skin, you were incredibly lucky.
Yeah, it's true.
Unicorn.
So you're going to feel totally like, you know, you're worried about what you feel like already from a personality development point of view, but then you're worried about your skin. So you have the rite of passage teenage years, which are difficult.
And I can't imagine how difficult it is for teenagers now with things like social media. I mean, when I was at school, it didn't exist. And it was one thing having acne, but, you know, you could actually go home at the end of the day and then sort of forget about seeing it. You know, now there is not that escapism, is there?
There's not. And I think the other thing is, even as an adult, it's so hard to recognise that social media is filtered and it's not real life. If you're a teenager, you still haven't developed that emotional maturity to recognise that people are posting their best lives.
Yeah, so true.
So it's not uncommon to see people come into clinic and they're like, well, my friend looks like this, or their skin looks like this, make me look like this.
It's that comparison that people have often.
There's that, and then I think there is the amount of people you're comparing yourself to, not the kids in your class, but the entire world, if you want to, because of social media. So there's that aspect. And then I think the group that we often don't talk about is the teenage boys.
That's true.
Because girls can wear makeup, and there is data that shows that if you wear makeup, that has a positive effect on your self-esteem.
Of course.
But it's not socially
for boys.
acceptable for teenage boys to wear makeup. So they're the ones that often already have almost mental health issues that we don't talk about. It's not acceptable for them to talk about. Then they have skin issues. And if you don't, you know, if you're the mother of a teenage boy, or you have nephews in your family and you can see they've got skin issues, it's actually really important to ask them, like, is it stopping you doing anything? Like, do you feel like you can't ask a girl out on a date? Or do you feel like you don't want to go and socialise with your friends?
A really good
or
point.
go swimming, but you've got spots on your back and you don't feel like you can take your t-shirt off?
Yeah.
So,
and also boys don't talk to one another in the same way that girls do. You know, there's a certain sense of camaraderie being a woman or a girl, a teenage girl. You know, potentially you're going to have friends going through the same thing, you're going to have those conversations. I think for boys to actually open up and start talking to one another is very rare.
It is, and particularly about skin, because it's almost seen as a vanity or a cosmetic issue rather than a medical one. And this is something I feel really quite, you know, these skin conditions, they are medical skin conditions. They're not issues with a little bit of, like, you know, injectables that might fix the issue. And I think one of the big problems that we've got is we're led to believe if you buy the right face wash or the right cleanser, suddenly this skin issue will get better. But if you've got a medical skin problem, you know, if you have diabetes or asthma, you wouldn't think twice about taking drugs or an inhaler.
Yeah.
We need to treat skin with the same respect. It's an organ.
Yeah,
and
I
it needs
agree.
medical care if you require it.
The largest organ of the whole body. I mean, as a dermatologist, obviously skin health is what you're aiming for, but, you know, we also can't forget about beautification. You sort of touched on that by saying the importance of makeup and things and sort of promoting that self-esteem. Because again, these conditions obviously do have a huge effect on our emotional well-being. So what exactly can you do to not beautify the skin per se, but to help minimise the appearance of conditions such as acne, for example?
So I think there's a couple of things. I mean, initially, if somebody has got a skin condition like acne, you want to make sure the skincare routine is optimised. The skincare routine won't fix the problem, but it's certainly an adjunctive treatment.
Yeah.
So these lifestyle measures are super, super important. And I know that you'll be speaking about this a bit later when it comes to food, but Dietary things as well can be totally relevant. So, for example, I see a lot of people that cut out dairy because of their skin, and they will switch often to oat milk because it has a good flavour profile. But oat milk has got a high glycemic index. It's really high in sugar. And if you want to look at clinical trial data, it's very clear that foods with a high glycemic index or high sugar that spike your blood sugar levels are far worse for your acne than a little bit of dairy. The dairy data is actually about low-fat dairy, not full-fat dairy. So I see so many people that will cut out full-fat dairy, switch to oat milk, and I'm like, the oat milk is probably worse for you than the full-fat dairy was. So it's about having those conversations with the teenage boys, often that start going to the gym for the first time. Are you taking whey protein supplements? Because there is data that shows that whey protein particularly can cause truncal acne.
So on the chest and shoulders.
Chest and back. So it's about asking those questions.
And sort of being a bit of an investigator, I suppose.
You have to. You always have to do a lot of questioning around. For female patients, your periods, are your periods regular? If they're not regular, should we be thinking about polycystic ovarian syndrome? It's common. 8 to 10% of females suffer with it. It's massively underdiagnosed. If you don't look, you don't find.
Exactly.
So you do have to look to find.
And I think sometimes people forget that these are the things that are going to impact their skin, don't they?
100%.
And actually it's up to you as the derm to obviously sort of tease that information out.
Absolutely.
And so once you have got the skin condition under control, what are the things you can do, sort of, I suppose, in an aesthetic world that can also sort of help to minimise the appearance, improve things like scarring?
So I always see the cosmetic dermatology as a generic term field in terms of there's medical cosmetic dermatology and then there's pure cosmetic dermatology. And what I mean by that is medical cosmetic derm, in my mind, is you have an underlying skin condition and you're doing cosmetic type treatments that can benefit that. So you've got acne scarring, that's a medical issue. So there are treatments like laser, like microneedling, like TCA cross, like filler, like subcision that can help with that. You've got rosacea, you've got facial redness, you've got flushing. There are light-based devices and lasers that can help with that. But what we're trying to do is try and essentially control a medical issue versus what I would see as pure cosmetic derm, which in my mind is more about there is no underlying primary skin issue, but what you're trying to do is essentially boost collagen in the skin or promote healthy aging in the skin. And they're two separate things. But from the medical cosmetic derm point of view, light and laser-based devices can be absolutely fantastic for treating things like scarring and rosacea.
Really? And how many sessions would you be looking at to actually get something like acne scarring under control?
So the answer here would depend firstly on extent and severity. I mean, how much scarring is there? What type of scarring is there? Which body sites is it affecting? Is it just face? Is it chest and back as well?
Can I just ask on that note, does acne scarring sort of manifest differently on the face to the truncal sort of scarring that you mentioned?
So generally speaking, if you look at acne scarring, you can get either indented scars or bumpy scars. That's like in its most two different types. Either the skin will look like it's got divots or it will look like it's got bumps.
It'll go one way or the other.
Indeed. And if you have got acne, particularly on the chest and the back, and particularly if you have skin which tans very easily or skin of colour, bumpy scarring is incredibly common on jawline, back, chest, shoulders, so this middle section of the body. So in that context, treatments like steroid injections to then flatten out the scars and then zapping it with a laser to get rid of the redness that you're left behind would be the right treatment. And in terms of the types of laser that you could use something like pulse dye laser, or you can use broadband light like IPL. But the context is what you're trying to do is get rid of redness. So you need a device that will target blood vessels underneath the skin. If you've got indented acne scarring, you can certainly get that on the face, the back, the chest and the shoulders as well.
Sort of little ice pick scars that you often see.
Ice pick, or you can get rolling scars, or you can get boxcar scars. So the ice picks are literally like somebody's got an ice axe and they've made a little hole in the skin and it's a little circular divot in the skin. The rolling scars are the ones where you've got indents, but it looks like a rolling hill. So it's not massively deep, but when the light hits the skin, you can see the skin texture isn't flat.
Exactly.
And then the boxcar scars are the ones that are almost like little craters in the skin. They're quite deep. And most people that have acne scarring will have a combination of those skin types, those scar types. And in that context, then, it's about, again, picking the right laser for the right issue. So generally speaking, if you've got indented scarring, you're looking for a laser that's not going to target blood vessels. It's going to target collagen in the skin.
To stimulate the collagen so that the
Indeed.
surface sort of plumps up and smooths out.
So the main laser types that would do that would be things like an erbium laser or a carbon dioxide laser. And then they have their pros and cons as well. So the choice that you would make would depend on, essentially severity, on recovery time that is acceptable to you, budget, skin of colour, because with carbon dioxide laser there's a higher risk of getting pigmentation afterwards. So then this is where the individual advice becomes really, really important.
You do need a very bespoke approach. I think, we'll all talk about this as well. Everything that each of you does as a practitioner is about the bespoke and the patient. But, certainly there's a whole world of lasers out there. And so you have to be very discerning which one you use. We spoke about makeup sort of earlier. Are there any sort of things that we can do in the short term? I'm thinking sort of makeup products, topicals that you recommend that can give that sort of instant hit of confidence for a patient.
So I actually very much like my patients to use makeup. I have been to talks in the past before where people have been like, you've got spots, you mustn't use makeup, it's terrible for you.
Yeah.
But actually, like I said, the data is very clear. Makeup can enhance self-confidence, particularly if somebody is on a treatment plan and their skin is improving.
And as long as you have a product that has ingredients that are, not detrimental to the acne.
There's that, but I think the bigger thing is actually making sure you just cleanse the skin properly, because makeup tests move on so much that most of the makeup products that we can buy now, they're not like stage oil-based makeup from the 50s that literally it's like wall paint. Most modern day makeup is actually formulated very, very well. So the key thing I would say is if you're wearing makeup and you're acne prone is to make sure that you're properly double cleansing the skin at night time. Your first cleanse either with your micellar water ideally, and then a foaming cleanser if you're acne prone you will probably tolerate without any issues. But I do think that there is positivity in wearing makeup. What I will say though is most people that have got a little bit of acne or rosacea often don't need a full face of makeup. You can just wear a little bit of concealer where you need it with maybe a tinted SPF, because a tinted SPF will also cut redness. So you don't, and that's a positive thing for the skin because you're going to reduce any pigmentation that you might get. So I think that's one really easy fix. The second thing is colour correctors and using really effective colour correctors. If you're prone to redness, green tinted primers are so good at cutting out red. If you've got issues with hyperpigmentation, so your skin is dark, you're getting dark marks from your acne, peach coloured colour correctors are really good at neutralising that. So I think you can be really clever with the way that you use these tools without needing to cover your entire face, but still get the coverage that you need and still feel good about it, that it's not hindering your day-to-day.
I think that's a really valid point, actually. Yes, it doesn't have to be the full face approach. It can be very discerning and very bespoke, much like you're doing with your treatments as well. What about sort of if you were to have an emergency breakout, sort of a spot that comes up before a date or a sort of big meeting or something? Are there any sort of quick fix things to very quickly take it down or minimise the sort of urgency of it?
Yeah, so I think if we start with the simplest thing that you can do at home, and then work up to the most complicated thing. So the simplest thing that you could do at home is maybe start with using a targeted spot treatment. So that could be either something you buy over the counter that contains 2% salicylic acid or benzoyl peroxide, which will shrink it very quickly, or a prescription-based topical treatment, which again contains either retinoid or benzoyl peroxide or a little bit of antibiotic ointment that can help shrink. Now that is one way that you can bring things down. The other way you could bring things down is spot plasters.
Hydrocolloid
patches.
The spot stickers. Yeah, exactly.
Dots for spots.
Yeah.
Dots for spots.
And they're good, are they?
They can be. The biggest way that I find that they're useful is most people that have spots, particularly big ones,
Want to
love
touch them.
pick and play with their skin.
Exactly.
And if you stick a spot plaster on your skin, it stops you touching your skin and it stops you playing with it and it stops you picking.
That's such a good point.
There is benefit from that because otherwise you can get a condition called acne excoriae, which is where you're picking and you're scratching the skin.
Yeah.
So often what you see is people have scratched their spot away. So they have a scab when they come into clinic because they would rather have a scab on their face than the actual bump or spot because they're so traumatized by the spots themselves. And it's really common, actually.
Yeah.
So hydrocolloid patches can stop you doing that.
Interesting.
And then if, literally time, money, no issue, you're booking with a dermatologist, they give you an injection of some intralesional steroids.
I
A
was going to
steroid
ask about
injection.
steroids, yes.
And what you can do is you can just literally inject the spot directly with a bit of steroid it goes down overnight.
That is literally like the pre-wedding, you know, the bride who gets the spot, the big day on the big day.
London Fashion Week. It happens a lot in London Fashion Week.
That's fascinating. The stuff you must see. And now you mentioned rosacea earlier as another condition that's really difficult because it's one of those sort of inflammatory conditions which we're told we have to just manage the lifestyle factors, right?
Yeah.
How have you found as a dermatologist to be the best, most effective way of patients doing that?
I write 3 pages of information for my rosacea patients when they come in and see me. So I always say when they come in and see me, so there are things that you can do and there are things that I can do and there are things that we can do.
There's the partnership element that you have to remember,
So I always start with the lifestyle stuff. And the lifestyle stuff is stuff like the skincare routine, for example. We have to start with that. In people who are rosacea prone and they've got sensitive skin, this is one context where I do think a physical or a mineral sunscreen is better than a chemical one.
Okay.
This is one context where I do think that using skincare that has got no fragrances and no drying alcohols and minimal ingredients can be of benefit. And this is also one skin condition where I think streamlining your routine, so you're not using loads and loads of layers.
Because you're just going to overwhelm the skin with everything you're throwing at it.
Absolutely. Rosacea prone skin is sensitive. The blood vessels and the nerve endings in the skin, they're super reactive.
Yeah.
And you want to put as little on the skin to set that off. So there is a very detailed skincare routine as step number 1. Step number 2 is your diet. And I'm sure you will go into this as well. But I am very, very fond of my rosacea prone patients taking high levels of omega-3. And the reason for that is, again, if you go away and look at the clinical trial data, there is a lot of data that shows that people who've got rosacea can often suffer with eye symptoms, up to 20%.
Really?
Get
what sort of eye symptoms?
Dry eye, sensitivity, inflammation of the eyelids, called blepharitis. And there is data in those eye patients that taking high levels of omega-3 can actually reverse ocular rosacea. And actually, then if you go back and you extrapolate the data, there is data that shows that omega-3 is relatively anti-inflammatory for the skin, and high levels can benefit rosacea-prone skin. Now, I always also say it is better from your diet than a supplement. I know that doesn't work for everyone, but if you can take 2 to 3 portions of oily fish, so mackerel, sardines, wild farm salmon, as an ideal scenario. If you can't do that, because some people cannot do that, they don't want to have fish in their diet, then actually your alternative is taking a supplement. And if you're vegan, a vegan-based supplement, that's fine. But that's something I do, again, insist on. If you know alcohol is a trigger, you may want to think about cutting down. A lot of people with rosacea find that clear spirits, for example, are better than things like red wine or something that has got a lot of tannins or colour to it. So it's a little bit of trial and experimentation there, but you can, from a dietary point of view, it's not about cutting, it's about adding things that you can put in.
And also getting to understand yourself and what works for your body, having that sort of hyper body awareness, I suppose, 100%. Skin awareness as well.
Third bit is mental health, the lifestyle, having started things that I do. But we know that stress can make rosacea worse, and then you're stressed, your skin is worse, you're more stressed, vicious cycle. Then you've also got the fact that rosacea is up and down anyway, and then you're going through a good period with your skin, but rather than going, oh my god, my skin looks great today, you're thinking, oh, my friend's invited me to a spa in 2 weeks, what if my skin flares up in 2 weeks' time? So you're living with threat and fear and anxiety of when your skin might flare up.
That's so true, you're sort of being ruled by your skin by that point.
Totally. So I like to refer everybody to clinical psychology. I would put everybody in therapy if I could. I think everybody can benefit from positive mental health and from that idea of actually just recognizing, you know, COVID has shown us we can't control every single thing in our life. And we need to get to a point where you can almost disconnect that skin-mind connection that you've got. And good day or bad day with the skin, everyone deserves to look in the mirror and feel good about what they see.
100%.
And not just feel like I'm looking in the mirror and I don't like what I'm looking at today. And I think a therapist can really help with that. So those are the lifestyle approaches aside from the medical approaches.
Plus your 3 pages of advice I have it. That's great. And that brings me on to my very final question very neatly, which is, I suppose, how you help patients to see that there is light at the end of the tunnel when it comes to skin conditions that are really causing them to, I suppose, sort of psychologically not feel the best version of themselves. How do you sort of help them get started on that journey and see there's some positivity that can come?
I think the first part of it actually is not being scared to ask difficult questions about mental health. I think it's very, very easy to go and see a healthcare professional and they can see you're upset and you're upset, but nobody is asking you, are you okay? And actually being able to say, how's last year been for you? What's been going on? Is everything okay? How is work? How is life? Are you okay going out without makeup on? Would you go to the gym without makeup on? And if you don't ask, you don't find out. And sometimes I know that if you ask the questions, you know people are going to get upset, and people find it easier not to ask. But actually, you can't help people by not asking them, what is it that bothers you? So I think the first step actually is actually asking the difficult questions that people don't want to do.
And the questions they don't want to ask themselves as well, probably, that they haven't admitted to themselves.
You know, you're looking after somebody, an unwell relative or whatever it might be, and you're just coping and you're getting on with it. And when someone says to you, do you think that maybe you've been a bit stressed over the past year? Suddenly there's a kind of a silence that well, actually, I've had this, and this happen to me. And I'm like, oh my God. No, I mean, that explains everything. So I think that's the first bit, is that open dialogue.
Yeah.
And then I think once you've got that open dialogue going, it's about building long-term relationships with people. No one's going to trust you immediately. You're not going to trust anybody immediately. But it's being able to see somebody repeatedly and know that actually they've got your best interests. Like, their end goal is also to get your skin better, but get you into a better headspace as well. I mean, I kind of feel like that's the primary function of what we're doing.
I think it's very powerful to have somebody on your team, to feel like you've got a cheerleader in your corner.
Absolutely. I mean, I say a lot actually in clinic, like, my job is to worry about your skin. That's why you've come to see me now. I need you to go away and just enjoy it. But then the third part of that is actually therapy. And I genuinely do believe that we should all be recommending that patients with skin conditions that flare, skin conditions that are visibly apparent to other people, we should be giving people help with that.
I totally agree. I think that's a really valid point, and not one I was expecting you to say. So really interesting and thought-provoking. Thank you so much, Anjali. Really interesting. I'm sure everyone will agree. Over to our next amazing panellist, Dr. Ifeoma. She's the founder of Adonia Medical Clinic in Maida Vale. It's had a recent facelift. It looks absolutely divine right now. She has myriad peels and lasers and body contouring devices, which I'm sure we're going to hear all about. But maybe, Ifeoma, you can start by explaining. I mean, you do sort of manage to perform multiple aesthetic procedures, but what's the one thing, I suppose, that unites all of us? If there's one single concern that we all have, what do you think it might be?
Oh,
it's a massive one. Sorry.
It is. So in the clinic, we offer so many different treatments, but I think the thing that people ask me most for is for clear skin.
Yeah.
And that means such different things to different people. So I may have a 50-year-old woman that comes in and says that I just don't feel the way that I should, or I feel I should. I feel energetic, I feel youthful, but when I look in the mirror, what I see isn't. Because I don't connect with the person. And for that person, I may be suggesting everybody starts with skin. Everybody, whether they're 18 and they see me or they're 90 and they see me. Everybody starts with trying to clarify their skin, trying to move them closer towards skin health. So for this lady that I might see, it might be trying to stimulate collagen. It might be doing a treatment that will shorten her skin turnover so that her skin does look more glowy, so that I'm able to then put injectables, toxin, PRP, whatever else treatments I'm doing. I might see an 18-year-old who says, I can't look in the mirror anymore and I hate my skin. And exactly.
That's so sad to hear.
And we help them with acne and help educate them on why they have acne, what acne is, the pillars of it, all the things that they can do at home, what skincare product they should never use again, and what skincare products they should lean into, and all sorts of things about stress and diet and everything else. I might see someone who says that my skin just looks dull and dehydrated and I don't know what to do with it. And again, education. So that's the foundation of everything that we do in the clinic. Or it might be redness or pigmentation.
Yeah.
And one of the benefits that I have is that I look at people holistically. So our initial consultations are 1 hour.
Wow, 1 hour?
1 hour.
That's impressive.
Yeah, so our initial
And what's that going through exactly?
So it goes through absolutely everything. So it's a very medical consultation. So we start with, what's your concern? So someone will come into me and say, my lip's done. I'm spending 1 hour talking to
And you'll unpick all of that and start with their skin.
Yes, we'll unpick all of it.
Yeah.
Or whatever their issue is, whatever they've come in with, we go through everything. So what's your main concern? Where did those concerns come from? What are the ideologies that have led to that concern? what do your friends think your skin look like? What do your family think your skin look like? What are the past treatments that you've had? What have you tried for your skin? What's your current skin concerns? What's your current products? And how do you use them?
Yeah.
So you may have the right product, but you're just using it in the wrong way. And one thing I never do is to say, oh, those are rubbish, I took them away. I always try and use the products that you've got, peel away the ones that aren't serving you, and then add in ones that can up-regulate your skin and boost your skin. And then we look at, when we examine the skin, after you've gone through family histories, we go through diet, we go through stress. Every single patient that comes through our doors has a body dysmorphia screen.
Really? Wow.
Every single patient.
Is that something you're seeing sort of on the rise, or is it just very important that you rule that out?
Well, the thing about body dysmorphia is that it's so high in aesthetics that sometimes you can't rule it out.
Yeah.
Sometimes you just have to understand that this patient has body dysmorphia, and we work alongside psychologists to help treat in safe zones and not treat in unsafe zones. So we work very closely with a psychologist and a psychiatrist, actually. So we screen everybody, and it's extremely prevalent. I would say, between 20 to 30% of people that walk through the door have screened positive body dysmorphia.
My goodness.
Because we screen everybody.
Yeah.
And then we unpick that. Because sometimes it's, if somebody has severe acne, of course they think about it every day. Of course they do. And so they would be screened positive, but when we do the full screen, it would be negative because they have a reason for it. And there's social aspects as well. So we go through everything, then we examine, and then we formulate a plan. And the plan is in conjunction with their GP. It may require referrals, it may require allergy testing. It's extremely robust.
Yeah.
And then we think about what we can do now and what we can do later on. So there's kind of an immediate, an intermediate, and then a long-term plan.
That's nice. So somebody almost gets the instant gratification of knowing that you're doing something in the immediate term, but they also know that they're on a bit of a journey with you. Yeah. Do you use sort of imaging devices in sort of skin to really sort of help people see what's going on beneath the surface?
So I don't do it every time, especially if there's an infection on the skin, then we don't do it.
Yeah.
But sometimes it can be helpful for things like hyperpigmentation. So sometimes you might look at someone's skin and they say, I just have a little bit of melasma just here, and maybe a little bit here.
We all love to be our own doctor and tell you what's wrong with us.
Yeah, you look at the skin and you can see melasma everywhere.
Yeah.
And then when you look in the scanners, and then you see actually you have melasma here and here and here, and it's here, and then they say, oh my goodness, because it's really important when you do a peel. Because when you do a peel, what happens is it comes to the surface. So at some point, it can make it look as if things are getting worse. And if they haven't seen those scans before or don't know, then all of a sudden, I didn't have melasma here before, now I do.
And now I've suddenly got it.
Wait 3 more days, it's about to disappear.
Exactly. It's all a process.
So it can be helpful to guide, to kind of show things like redness, inflammation, and melasma, hyperpigmentation. These are the 4 that I find that it's really helpful for.
Yeah, exactly. Also, it's good just to have that data in black and white, isn't it? I sort of find, just to actually know what lies beneath the surface. And like you say, things like the pigmentation, which you as a doctor know it's coming to the surface. We as patients don't always realise.
Looks like it's getting worse.
Yes, exactly. And what about people's skin colour and skin type? How does that inform the sort of treatment journey that you put them on?
It's huge. It's huge. One of the real pillars in the clinic is we treat all skin types. And that means that we've thought about what products do we have, what devices do we have, what lasers do we have, so that whether I have somebody who's of Irish descent or whether I have somebody who's from sub-Saharan Africa, I'm able to address their needs fully. And that's been a tough process.
I bet.
Thinking about, okay, do I get this laser that costs £20,000, or do I get this laser that's really expensive but can treat all skin types? And we've made the decision every time to go for, do I have a skin tightening device that can treat different skin types?
Yeah.
Do I have a microneedling device that's encapsulated in a way that can treat every skin type? Do I have the products? Do I have the HIFU? Has this high intensity focused ultrasound been tested in skin types 4, 5, and 6, and not just in skin types 1 to 3. And the interesting thing that happens is when you have devices that can effectively treat every skin type, my skin type 6 patient, so somebody who is sub-Saharan Africa, darker than myself, would benefit, and my Irish patient who has freckles also benefits, because I have a device or a treatment or a product that in one treatment can do a lot more than, so there's so much crossover. So this is a real pillar in the clinic, and it's, that I really champion.
And it's so important that you have that inclusive, sort of diverse approach to being able to help everyone, regardless of skin type or sort of Fitzpatrick type, as you said. And I certainly think it's what sort of sets you and your clinic apart. Maybe we can talk a little bit about the concept of beautification. So I sort of mentioned it with Anjali and sort of the treatments that she does sort of long term to sort of help minimise things like acne. But when we're talking about beautification in aesthetics, it has a slightly different connotation. I mean, what are your thoughts? And maybe you can explain sort of what we're talking about when we first say beautification.
So when we say beautification, it really means enhancing your results. But for me, that term has almost lost its way a little bit. Because beautification in aesthetics sometimes has mean increasing someone's look to a specific aesthetic. And that makes me want to vomit.
Yes.
And I think I've always tried to stay far away from this. Because even if you look at the supermodels, we all agree that they're beautiful. They're so different. If you look at Naomi Campbell, Alex Weck, if you look at even women who aren't supermodels, let's look at a Kardashian. She's beautiful in her own way. If we look at Kate Blanchett, they're all beautiful, but they're so different. How could we ever say that if we did a treatment on any of them, we could turn them into a specific aesthetic ideal? So I think beautification for me, I'm always like enhancing your natural results, enhancing your own beauty, identifying what your definition of beauty is and working towards that. And in
celebrating the individualism of each patient.
Exactly. And for you, that might mean a skin treatment. For somebody else, that might mean a hair treatment. For somebody else, that might mean a medical treatment. So always respecting what you believe your best aesthetic is and then working towards that.
Because there's something sort of when you think of beautification, it often takes you back to that sort of time of looking at facial thirds and fifths and sort of proportion and ratio and trying to create trying to create everything that is too idealized. And I think your approach, which is obviously bringing out the individual beauty of the patient, is so much more relevant. But what about sort of creating facial balance and harmonization? Because you're really, really proficient when it comes to injectables, dermal filler, toxin. Why is that so important for restoring a patient's self-esteem?
Because for some people, this is critical. Everybody ages differently. And some people will age with volume loss. Much more. They'll have very few fine lines, very few wrinkles. Their skin looks great, but they've just got massive amounts of volume loss. And this can happen for all sorts of reasons. Weight loss, illness. And no matter how hard you try, it is almost impossible to gain fat on your face. And that can really...
If only it just went to the face.
I know, if only. And having a strategy that you can look at old pictures. This is what I do. I'll sit with my patient in that 1 hour consultation and we'll look at old pictures. We'll look at their natural anatomy. Where did fat sit before? And we will never place filler where fats didn't sit before, because there's nothing worse than looking younger but different.
Yes, exactly. Nobody wants to look different.
Nobody wants to look different. So everybody has their own aesthetic signature. Where fat should sit, where fat shouldn't sit. So there's some patients that I will look at them and they'll say, you've always had a tear trough. You've always had deep circles underneath your eyes, and you looked youthful, you looked happy, you looked radiant. Why are we now going to create these mounds underneath your eyes? Were you happy with the way you looked when you were 25? Yes. Did those tear troughs ever bother you? No. Actually, it's because you've lost volume in the mid-face. This is the reason. And when we look at these photos, it's like re-education saying, okay, you know what? Everybody else says that they have their tear troughs done, or they have their temples done, or they have their cheeks done, and they look better. But for you, what is your aesthetic ideal? What made you love yourself before? And let's work with that. Let's work towards that. Whether it's radiance in the skin, glossy skin, reduction in fine line, volume redistribution, or proportions change. Because there's certain areas of the face that the bony structure changes. The orbital hollows get deeper, so we get deeper eye sockets. For some people, the piriform fossa, if you press the edges of your nose and press down, that part widens, so you end up with a wider nose. Or for others, the chin, we get recessed chin. So looking at structural elements of the face and saying, actually, what has changed? So actually, we don't need to do all these other treatments. We just need to do your chin. for your nose.
And all of these things really do lie beneath the surface, don't they? I mean, if you were to say to somebody you've lost volume in your temples, people never look at that area, do they? They're like you say, I want to get my lips done.
Yes.
I want to get my tear troughs done.
my tear
They
troughs
forget
done.
about the foundation, and actually that's probably the most important thing for you to first look
Yes.
at, isn't it? The architecture of the face.
Absolutely. I would say the lips are the last thing I do. The last thing I do and the least that we do.
Yeah.
So when somebody comes and asks for their lips, it's almost always because they've got nasolabial folds, they've got volume loss in their cheeks, their chin has recessed, so their lips look deflated. Or they're trying to put their lipstick on and their lipstick's bleeding above and think, I need my lips done. No, it's the architecture of the skin. We need to strengthen the skin. We do not touch the lips. We need to strengthen that skin so the skin sits up. And when the skin sits up, you can
Everything
align
looks
your lips.
better. Yeah.
And your lips.
And you need to support the area around it as well, don't you? So actually you could end up actually having a little bit of dermal filler to your chin
Exactly,
or your jawline,
the
or
chin,
sort of in the base of the
jawline.
nose.
Exactly.
It's
and
really
all of that
interesting.
makes the lips sit up. And then we reassess and say, do we really need to touch the lips now?
Yeah.
And they're like, no. And so because I think if you do the lips without addressing the rest of the face, this is how you create these looks that look really artificial. Because if you look at your pictures, there was never a time in history you had lips that looked like that with the rest of the face. And that's the disconnect.
And everyone is going to notice.
Everyone will, and nobody
Yes.
wants that.
No, exactly.
We want invisible results, and that's the thing that I always say. We want invisible results. People say, "Oh, I like your earrings. That jacket's really
Exactly.
nice," and they have no idea what you've done.
You've been on holiday, you've
been on
lost
holiday.
weight.
You're like, no, I didn't.
What is it?
I'm
No,
not
I had my
telling
lips
you.
done. Actually, I didn't have my chin done, or whatever it might be. Tell me about skin boosters, because I think they're something that have become huge in recent years, but they've also had a sort of amazing sort of growth in public perception as well. So what are you using at the moment? Because there are all different types and they all do slightly different things.
We have all of them.
Oh, of course you do.
So
For different
and
skin
for
types and
different-
colours,
and
yeah.
for different reasons. So I think after lockdown, people started looking at their skin in a very different way. Before then, people said, I've got a line, I've got a wrinkle. After lockdown, people said, my skin looks different. People started saying, I've got hyperpigmentation, I've got redness that I don't like. I noticed that my eyes look different. They started describing the skin in a different way and not wanting to rely on makeup. Whilst I certainly agree that makeup is an excellent tool, I love to play with makeup, but I don't want to rely on makeup. And a lot of my patients say they want to be able to have makeup-free days. They want to be able to go to work and not have to think, I can't leave my house without putting makeup. I have to go back in. Just to be able to run, quickly post something without thinking, oh, my family are going to see me, my friends are going to see me. That worry, they want that to be less. And so skin boosters can help with that. So it sits alongside the rest of the treatments that we do. So once the skin, that's how you've got good skincare routine, you're doing the treatments, sometimes you have dullness in the skin. And we want to have, I think of them as more internal moisturizers.
Yes, it's like the injectable moisturizer. Everyone
Exactly.
sort of coined it when it first launched.
So there's things like Profilo, and also using now PRP with hyaluronic acid.
And PRP is when you take the blood, you sort of spin it down and you extract, is it the growth factors?
Yes, so you've got platelets, you've got growth factors, and now they've got newer technologies that also have hyaluronic acid in there as well.
Great.
And something like Profilo has about 35 grams of free hyaluronic acid in a 2 ml syringe. When you do it with PRP, you can get 5 mils or 40 milligrams. So
My goodness,
even
you can really
more.
supercharge
You can
it.
yeah, you can do more. And the thing about free hyaluronic acid, the good things about it is that it holds on to moisture, it helps, it gives you instant glow. The things that aren't great about it is that it doesn't last very long. So it lasts about 6 weeks. So it's a great treatment if you have an event. If your skin is feeling dehydrated and you want a boost, this can be really helpful. But it doesn't supersede your skincare routine.
No, exactly. That always has to come first. And do you find sort of different skin types react better to the different products that you use, say a Profilo versus a Volite or a Bellaterra Revive or whatever you might be using?
So something like Bellaterra Revive, I really like it for around the eyes because it has vitamins in it as well, and I find that it's helpful for venous congestion. So anyone that has like dark circles, redness around the eyes, or kind of a reddish grey, that would be great. While somebody else that has very, very thin accordion lines, so very, very, very thin lines across the face, a Profilo would work very well for.
Yes, exactly.
So depending on where on the face the issue is and what the issue is, the treatment would differ.
And what about body treatments? Because you have, again, a device, whether you're contouring, whether you're freezing fat, whether you're toning muscles. What are you seeing the greatest demand for now when it comes to the body?
The biggest demand now, I think, are things that have the bridge between fitness and wellness. So the M-Sculpt Neo is phenomenal.
This is the sort of high intense frequency magnetic.
So it's
induction.
It's two technologies in one. It's high fem technology. So high fem technology. Do you guys remember the old Slender tones?
Yeah, exactly. You'd sit on the sofa and
not that.
get zapped.
It's not that, but it has a similar technology in there. It's causing 100% contraction of the muscles. So where it has the link between medical and aesthetic is that it can be helpful for some medical conditions like diastasis recti. So when after pregnancy, men can also get this from extreme constipation. The muscles usually sit like this. There might be sometimes a small gap, and that's normal, about 2 millimeters, 2 fingers in there. It can widen. And sometimes after pregnancies or just in life, it can widen and stay there. So this treatment can help. I used it myself, it was a problem. It can help bring it together. Now, after pregnancy, it's normal, and for the first year, entirely normal. But some women, 5 years, 10 years after pregnancy. And some of the historic options include just surgery. And if you have young kids at home, that may not be possible. You may have tried Pilates, and Pilates will help, but some people it just doesn't work.
Yeah.
So treatments like this are now helpful. Also, other treatments that can be helpful in incontinence and also sexual dysfunction. There is a high fem chair as well.
Oh, do you have that?
Yes.
Oh, great. The M-Seller it's called, isn't it? Yes.
So one of the great things about that is that you don't have to take your clothes on. There's no internal examinations. And women who cough, sneeze, jump, and have pass a bit of urine, also men as well, it can be helpful to tighten the perineum.
Interesting.
So,
and do you find these treatments are sort of beneficial because they're improving aesthetically what we look like? Is it because they give us enhanced physical performance? Is it about self-confidence? Like, what are we addressing really with these?
I think it's all the above.
Yeah.
Because when you have something like diastasis recti, you have back pain. You're unable to do lunges. You're unable to do planks. When you have to adjust your body to get into certain outfits. People will ask you, are you pregnant all the time when you're not?
That's a bad one.
So there are aesthetic reasons, but there are also physical reasons as well. So a lot of my patients now will have these treatments for both. They want to be able to wear a bikini. They want to be able to get into their jeans. They don't feel they need to lose weight because they don't need to lose weight.
Yeah.
So there's a crossover between general wellness and, at least in my practice, I'm not sure if you found this as well, that a lot of people now are looking at general wellness. It's not just about their skin. They also want to look at how they feel, how their skin makes them feel.
What do you think is driving that?
I think it's COVID. I think all of us had a hard reality that things can come in left field and totally change our worlds.
Exactly.
And we spent a lot of time indoors. We spent a lot of time looking at ourselves and thinking, what do I want out of life? When you're stuck at home, imagining being on a beach, imagining all the things that we imagined that we would do that we still haven't done in COVID, I think people just started to think, you know what, I have to take my health seriously.
Yeah, it's
and
true.
Also, we had constant messaging that doing things like taking 1,000 milligrams of vitamin D for 5 days have been shown to be effective for things like improved immunity. So we started to hear, I think a lot of patients heard, or a lot of the public heard continually about actually how things can impact their immunity and their sense of self and their wellness. So it stopped being just take a vitamin. Actually, if I take these vitamins in these ways, it's been shown to do this.
Yeah, it's living and breathing it now, isn't it?
Yeah, and I saw an increase in things like PRP and NAD supplementation, in cryotherapy, and loads of these different alternative techniques that historically we kind of thought, oh, that might help a little bit.
It's so
more
true.
Evidence being more time.
A lot of the things that people always probably poo-pooed a bit.
Exactly.
Like me, for one, I sort of always thought that meditation was never something I was going to be able to get to grips with. It just seems so boring to sit there in silence and tell my brain to do nothing. But actually, during lockdown, it became a really beneficial thing. And I think you're right. A lot of people had that sudden realization that these other complementary therapies were actually really beneficial for their overall well-being.
Really beneficial. And I think that spills into the types of treatment. So whereas before somebody may say, you know, I want abs, now it's like, you know what, I actually want to build my core.
I just want to feel stronger.
I want to feel stronger so that I can do this.
And
as
also,
opposed to I just want abs.
And also it's about longevity as well. You know, I hear sort of people saying, you know, I want to be stronger so that I can pick up my grandchildren, so that I can do more, so that I can, you know, run that sort of 10K or whatever it might be. I think we're all pushing ourselves because, you know, hopefully we are all living longer.
Hopefully.
That is a nice note to finish on. Thank you so much, Ifeoma. Really fascinating as always. And our final amazing panelist is Olga Hamilton. She introduced herself to you earlier, and she is head of nutrition at Body Maya. She works here from the Lanesborough. They're very lucky to have her. She's an incredible nutritionist. Olga, you mentioned in your own introduction that skin was a huge focus for you as well. Maybe you can explain a little bit to us about your skin journey and sort of how that got you into doing what you do now.
Yeah, ever since I moved to London, it was about 17 years ago now, I started getting really bad eczema on my face. And you all can imagine how bad it was. And it was it was a wet type, the subcutaneous liquid was kind of leaking through, and it was cracking, it was getting infected and bleeding. It was just horrendous, and all on my face. I had a little bit of my hands and arms, but it wasn't as bad. It was kind of controlled. So of course I went to traditional therapy, steroid creams, and it was a light therapy I was offered, which side effect is skin cancer. And I think that was all really. Some moisturizers, really heavy emollients. That's all our traditional medicine actually has in a toolbox. And then of course I started exploring all other avenues. I did hypnotherapy for 2 years, acupuncture for 2 years. I went to the Dead Sea in Israel because they have the best skin clinics there. I was there for 6 weeks.
Wow.
I went to, I did homeopathy also for maybe 2-3 years or so. And unfortunately, nothing helped.
You exhausted all the options.
Just a little bit, and then as soon as I come back to London from Israel, everything comes back.
And it's like what Angie was saying as well, when something is on your face, you can hide it on your arms and your body, but on your face it's obviously a huge sort of knock to confidence.
It was huge, yeah. And then I changed my diet.
And look at you now.
Diet. I changed my diet. And guess what happened? I had remission for 9 months for the first time.
That's incredible. So
years.
what exactly did you do to your diet? Were you omitting things? Were you being quite strict? Were you adding in?
Everyone's asking the same question, but I think it's the wrong question to ask. I think
Tell me the right question.
All about the ecology of my gut. It all comes down to here. But I now can tell this after 5 years of studying at university, doing nutrition for 10 years, practicing and seeing clients with eczema. Only now I realized what it was, but it didn't really matter what I did. I just needed to change my diet as dramatically as possible. All I was eating was cereal for breakfast, sandwich for lunch, pizza, pasta for dinner. Wheat, dairy, I had cheese, coffees, sugar. I had to exclude all of that, and that was the bulk of my diet, and this is why I helped, because it changed the gut microbiome dramatically within probably days, and that's what happened.
So actually you're right, it's less about looking at the diet and more just looking at what's going on in your gut.
Absolutely, yes. Absolutely.
Because I suppose also each of us has our own sort of unique sort of gut microbiome, as you said, and so actually it's about finding the right diet essentially that works for the individual.
Absolutely. And despite me carrying on that diet for 9 months, after 9 months my eczema reappeared, of course, surprise. So I kind of knew that what I was doing had something in it. It was the right path, but I just had no clue what I was doing with my diet. And this is why I think it was 2008, I got made redundant from my Estee Lauder job. I was doing
You're working at Estee Lauder? Wow.
Yeah, but I was in financial department at Estee Lauder head office here in London.
Wow.
And then I was crying for 5 days straight, but I didn't know what to do with my life. But then I was like, okay, well, I have the money now. Maybe I should follow my passion. Maybe this is where life leads me. And this is how I became a nutritional therapist. I went to study here in the UK. And then initially I specialized in skin conditions like psoriasis, eczema, dermatitis, rosacea, and acne.
And so what are the most common skin conditions that are coming up when a patient does come to see you?
Well,
all of those things you just mentioned.
All of those things, yes.
Yeah.
Probably equal split, yes.
And what do you think is driving this?
That's a very good question. There's so many. I mean, of course, we know that our diets are not great. Of course, yeah, it's a Western type diet, which is pro-inflammatory, which can affect our health from loads of different angles. And other things are obviously stress, the environmental toxins. We're surrounded by them, and we need to have the very efficient clearing system, let's say, so all of our detoxification system, and how many people are constipated. Sorry for saying that, but yes, I see them every day in the clinic.
Yeah.
So the detoxification system isn't working properly, and skin is probably the largest detoxification organ that we have, and everything comes out on your skin. So you have to consider everything.
It really is a sort of a bellwether, I suppose, the skin for what is going on internally, isn't it? And if there is disruption or imbalance somewhere, it will ultimately probably come out in the skin. What does your initial consultation look like when a patient comes to see you?
Yeah, before they come to see me, I usually ask them to complete it's a 6-page nutritional questionnaire.
That sounds fun.
It looks like all of the body functions, your energy, your sleep, your lifestyle, your diet, your digestion, it could be some really weird symptoms that we don't really pay attention to, like feeling cold in our fingers and toes, or like the white bits that you can see on your
nails, yes.
Things like that. So it's a lot of different signs and symptoms that would indicate certain potential nutritional deficiencies or insufficiencies. So I analyze everything before you come to the clinic, and of course before you come I already have some idea of what may be going on, and we will explore that further. Then we'll look at the dietary changes, and maybe potentially some testing. Testing is really, really important.
Okay.
Because as you probably know, there's not one perfect diet that would work in a perfect way for everyone. It just does not exist. So we have to find your own perfect diet, and I need to know everything about you before I can make that recommendation.
So what are the sorts of tests that you're doing?
So if we're looking for different skin conditions, it would be slightly different, right? So for example, for acne, we know that androgens like testosterone, and there is a DHT, which is dehydrotestosterone, which can drive acne. So we would then do, I really like if you use the doctor's laboratory, so they do the PCOS panel, which is not only for PCOS, but also for facial hair, for acne. So we'll look at all of the androgens and insulin specifically. So that would tell me,
is that a blood test that you're doing then?
Yeah, that's a blood test. So this is something I would do for acne, for example. If we're dealing with, say, eczema or psoriasis, I would rather look in the gut first, because this is the first place really where we have to look.
Yeah. So that's about sort of stool testing, is it?
Stool test, or microbiome test. Yes.
Okay. And how do you go about sort of, once you've got the results from those tests, how do you then go about sort of creating a plan for the patient that you're seeing? What does that sort of journey then look like for them going forward?
Right. Okay, so I recently had an acne patient who's been suffering. She's quite young, 25. She's been going to do lots of laser, lots of different treatments, topical treatments. So when we did her stool test, we did identify a specific type of, we call it pathogenic bacteria, something that we know can cause acne. So acne can also be caused by a specific type of bacteria. It's not only because of androgens. So, and then I would devise a plan which would target that specific bacteria. So we need to reduce the growth of the bacteria, and we need to substitute it with the more beneficial type of bacteria. So we're changing the whole microbiome balance.
So the ratio is completely changing between good and bad bacteria.
Types of bacteria, yes, the numbers, and everything.
Wow, it's almost like a very precise formula then.
Yeah.
And am I right in thinking that every skincare condition then is affected by a different bacteria?
That's right. Yes, I did look it up recently. There was a very new review study which kind of reviewed all of the skin conditions and the connection to the gut microbiome, and they actually they did like a big table where they did acne, this bacteria, dermatitis, this bacteria, psoriasis, this bacteria, and it was just black and white basically. They did find, so basically if you test all of the people who have psoriasis, they will all have that type of bad type of bacteria, for example. If you test people with acne, they'll have different types, and they kind of summarize it all in a nice table, so I use it as a reference.
That's really interesting. And so it means there's a very sort of individualized approach to treating each type of bacteria sort of imbalance.
Yes, that's right. There are specific type of antimicrobials or antibacterials that you can use against the bacteria. Some of the so we have 4 gut microbiome test labs that they do that, and they all kind of generally the same, but they do have slight differences between them. So, for example, the Genova one, which is the American one, they do sensitivity panels. So when they identify bad type of bacteria in your gut, they test different types of antibiotics against it and the different types of natural agents against it. And they can show you, or me, which one I should be using in this specific case. Because I can have the science which bacteria is killed by which antibacterial. Like antibacterials, we would use oregano oil, berberine, neem, allicin, so specific antibacterial compounds that come from herbs.
Yes.
But they becoming very, very, very specific nowadays. So now we can tell which ones can kill what. But when the lab does the sensitivity panel, it even gives us more confidence in the treatment that we're going to
in knowing what you're doing.
Bacteria, believe it or not, they can develop resistance to antibacterials in the same way as they develop to antibiotics.
Yeah, I can imagine. And so what does it look like for the patient who's taking, are they sort of supplements? You sort of mentioned all these oils and sort of more herbal remedies almost.
Yeah, they're over-the-counter supplements that you can buy on the internet. Easy, yeah.
That's really straightforward. And what about sort of the role of stress? Because I think that's something that we've all sort of touched on a little bit. Does stress impact on the gut and the microbiome, which then impacts sort of the skin?
Yeah, every time I went to a doctor with my eczema, everyone says, it's stress.
It's stress, exactly.
No.
And it's such a difficult answer to get from people as well, because, you know, we all know how difficult it is to reduce stress.
Yes, absolutely, yeah. And it is right, yes, stress does have an effect on our gut microbiome and on our digestion as a whole. And I've been just looking at some studies to kind of tell you a little bit more about how exactly it works, and I have an experiment for you to do. So if you all close your eyes and imagine that you are biting a piece of lemon, and you're chewing the piece of lemon and chewing, and you can taste all the bitterness and sourness and juiciness on your tongue, and you bite it again and it just explodes in your mouth, what do you feel in your mouth? Is there a saliva production? Yeah.
Yes.
Yeah. So you see, just thinking about something affects your digestive system. So imagining eating something sour, bitter, or something you really like, or smelling something would get your digestive juices going immediately.
I think anything sensory as well. They say if, you know, your food is really beautifully presented, it sort of gets your digesting going immediately, doesn't it?
In the same way, stress can have a detrimental effect immediately. If you feel stressed for whatever reason, it shuts down your blood supply to the digestive organs. It's not a priority straight away. All of the blood is diverted to your muscles and to your brain, so you can either
it's a sort of fight or flight reaction
or run away. And you can also get evacuation, right? So the diarrhea straight
the opposite
away.
of the constipation you mentioned.
Because again, it's easy to run without anything in your guts. And it's not only that. So it immediately changes the environment or the temperature or the conditions inside of your gut, right? And this is where beneficial bacteria resides. They need to have specific conditions. They need to have food, light, temperature, space, mucus layer where they like to leave the furniture, so to say. If they don't have it, that's it, they're gone. I've seen people who've been through traumatic experiences. I do the test and I see all of the beneficial bacteria wiped out completely.
Really?
Completely.
So you actually have to create a really nice environment for them to want to stay and live in.
Exactly. Yes. Just taking probiotics at this point, you're not going to do anything at all.
At what point do probiotics come into the conversation?
I'll probably say so. First of all, if we identify pathogens, we have to clear them. So that's about, depending on the numbers and on the different types, we'll probably say about 6 to 8 weeks. That's the first phase. Second phase, we create in the environment. And maybe then we will add something that would build the mucus layer, that would add bacterial food, like prebiotics, for example. And then that would probably be about 4 to 6 weeks. And then only in the third phase we will do probiotics.
It's really interesting, your approach, how you're sort of recultivating the whole gut.
Yeah, it's like looking after the garden, you know. You have to pick up the weeds first.
Yeah, and create the optimal environment for all these things to flourish. And so how long does that process take for you to recultivate the gut and sort of really get it into a place where it can then not have a detrimental effect on the skin anymore?
I'll probably say 6 to 12 months. That's how long it takes, yes.
And
it's not immediate results.
And then are your patients on an ongoing sort of course program with you, supplements, sort of anything, or once you've recultivated, things do tend to improve?
Things do tend to hold, yes, I'd like to say, unless they slip back to their bad old habits. Like, of course, we know alcohol is bad, you know, having a really stressful environment is bad, or really bad diet, like Western type diet. So if you go back to all three immediately, then of course, yeah, you probably need to take something to kind of try to maintain it.
Yeah.
But if you change and if you try to always be better and maintain good diet, you know, have a lot of fiber in your diet, have real foods, then you don't need to.
Yeah.
It's,
that's really nice actually to hear that you can sort of maintain it yourself. And also, where do hormones fit into this? Because again, it's something that we all spoke about. How often do you find that actually hormones are the sort of cause of what's going on? You sort of mentioned the tests you do right at the beginning.
Yes, so some people, again, we're trying to understand what the potential reasons are, do produce higher level of androgens. So this is why people have higher risk of developing PCOS.
The polycystic ovarian syndrome.
Polycystic ovarian syndrome, or hirsutism, so the increased facial hair growth, females especially, or acne. But we recently found a link that, again, it's all because of the gut microbiome, yes.
Of course.
And
Staying on topic tonight.
Yeah, with the specific types of bacteria, they help clear androgens from our system. And we have this, we call it, so it's an enzyme we have in the gut that is produced by a specific type of bad bacteria. It's called beta-glucuronidase, and some of the stool tests actually check for that enzyme. So when our liver needs to get rid of testosterone, right, and we've used it, now we have to get rid of it. The liver kind of puts it in the box and puts the ball on top of it and sends it off with the bile, and through your gallbladder, through your liver, out of your guts. Right. When this box comes in direct contact with beta-glucuronidase enzyme, it opens the box and it makes you reabsorb that testosterone back into your circulation. So it's called secondary circulation of the hormones, or steroid hormones, and that just adds to the hormonal imbalance. Again, all back to the bacteria.
Yeah.
So we can manipulate that, or we can change that through the help of bacteria.
And then final question, what are the things, I suppose, from a nutritional point of view that we can do at home to strengthen our skin before we come to book in and see you?
Right. If you don't have any specific issues, I suppose, if you just want to maintain your skin youthful appearance, I've looked into this recently. You know, there's a lot of different collagen supplements on the market. And
people always ask us about collagen supplements. I'll be really interested to hear what you say, actually.
Actually, it does work. It does, because our body needs to have 3 amino acids. I think it's glycine, proline, and third one, I can't remember. Yeah. So you need to have the pool of those 3 amino acids in order to make collagen. We're constantly making collagen, we're constantly breaking it down. There are lots of different factors that can affect collagen production or breaking down. But you always need to have raw materials, absolutely. So most of the supplements just provide you with the raw materials. They provide you with either pre-formed collagen or the amino acids with vitamin C, with certain antioxidants, and certain there are some things that can help in the whole process. I did put a couple of supplements at the back of the room if you want to have a look. I'm in no way, this is something that I've been using myself and trying. So marine collagen is considered to be more bioavailable rather than any other sources. So that's not good for vegans, obviously, because it comes from fish skin. And then there are other that would be suitable for vegans. It's just like a handout I put out there, which contains those 3 amino acids and some of the vitamins and minerals that help collagen production. The other 2 that I find really effective is the hyaluronic acid. You can take it as a supplement. And I found that the Viridian makes a very, very high dosage, which is 200 milligrams.
Yeah.
So if you take that once a day, they've done the studies, so they, of course, that's biased, but you also can look at unbiased studies on PubMed. It does end up in your skin. It does go into your skin, and it does improve elasticity, hydration, and some other parameters.
And the hyaluronic acid is like the holy grail. It's what we're all trying to pump into our faces or stimulate some way or another.
And there is a third one that I found, which is called astaxanthin, which is why Creole flamingos are pink. This is like a natural sun protection. And you can build it up by eating or by taking astaxanthin as a supplementation. You only need 5 milligrams. And it's also shown in studies to be super effective.
Perfect. Yes, and so anyone can go and have a look at is it a collagen supplement you said? Is it the
it's a collagen supplement, and one of them does contain hyaluronic acid as well.
Wonderful. Very, very helpful.
Astaxanthin, it's a very difficult word to pronounce.
It is such a mouthful.
Yeah, such a mouthful. A alpha, S Sierra, T Tango, A alpha, X X-ray, A alpha, N November, I.
THIN.
Yeah, if you start Googling it, you'll come up.
Yeah, exactly. I love it, taking notes. Perfect. Well, thank you so much, Olga. That was really interesting to understand how the gut sort of feeds into skin and the conditions that it might manifest in. And I think you've tied everything together really nicely, so thank you. That very much wraps up tonight's discussion. I hope you've all found it helpful and informative in some way. I know I certainly have. So I suppose before we go into an audience Q&A, a big thank you from me to you guys, our amazing Beauty Triangle, for all of your wisdom and solutions and general advice. It's been fantastic to listen to you. We do have time for an audience Q&A. If you have to leave and scoot off, by all means, please do, but don't forget your goodie bag. Victoria will have those all ready and waiting for you. I promise you won't want to leave that behind. Were there any questions before we sort of wrap up? Everyone has been taking notes very vigilantly. Yes, right at the front.
I have a million questions.
Well, you're the only one so far, so please ask away.
I'm selfish to take the floor.
No, go for it.
So, obviously, Christmas is coming. People will be buying lots of gifts. I'm just thinking about, Christmas is coming, and we're in a cost of living crisis. So, I'm just thinking about what kind of at-home products or at-home devices, or is it all a load of nonsense, or are there actually things that we can do at home?
What does everyone think? Ifeoma, do you have some thoughts?
I do. It depends on your goals. So in terms of Christmas presents for other people, challenging because you have to know what their skin concerns are, you have to know what their goals are. But for yourself, there are lots of products that you can buy that don't have to cost the earth. And I don't believe that your skincare has to cost the earth. In terms of building a good skincare routine, I like to keep it really simple. And there are 5 steps that everybody can take if you're trying to build a good skincare routine. Cleanser, an antioxidant. And if you're like, oh, I don't know which antioxidant to get, niacinamide is great because most people can tolerate it. A moisturizer and a factor 50 sunscreen. If you're trying to be a really good friend, that's great. And then the 5th step in your skincare routine is how you really customize your skincare routine. And that's your treatment step. And that would be the one step that you spend a bit more money on. That's the thing that really bothers you. So let's say fine lines are your concern, you might want to start off with a retinoid. If redness is your concern, you can get over-the-counter azelaic acid. If hyperpigmentation or dark spots, you might want a tranexamic acid or an arbutin. And if dryness is your concern, maybe hyaluronic acid. So that's kind of a really easy few steps that you can kind of build a good skincare routine. And if it's someone that you know well, then you can kind of say, okay, if they've got oily skin, have they got dry skin? If they've got more oily skin, I'm going to go with a foaming cleanser. If they have more dry skin, I'm going to go with a gentle cleanser. But if you're not sure, one of the great things to do is give them a gift card. Yeah. There's so many places now, it's like the Sephora, Space NK, Boots, and they can go wild.
That's nice. Angelique, do you have any thoughts on at-home products, devices? What are your thoughts?
So I think as a general rule, I'd say home devices are never going to be as effective as anything you get in a clinic. And that's pretty obvious because of safety reasons. Now that said, I have got a ton of home devices. The problem with home devices is they're great, provided you use them.
Exactly. So many of mine are sat gathering dust.
100%.
Haven't even looked at the instruction manual.
Or you get them and you're really excited about them for like a week or a couple of weeks or a month, and then you stop using it.
Yeah,
so
agreed.
Home devices that I actually quite like, and I was very excited about when I first got them, The New Face radio
It's really
frequency.
good. I
It's
love
not bad
that.
actually.
Everyone loves
Yeah, I
the New
love
Face
it.
radio
I love
frequency.
it. Yeah.
I have one gathering dust in my bathroom cupboard.
I use it every day for a month and then I stop using it. But it will give you a temporary lift. So it does work,
Is that
provided
the
you
one
use it.
that's launched in Selfridges?
The radio frequency one.
It's
Yes,
the little one with the
No,
It's
that's
It's New
that-
Face, NU.
No, that's
Yeah,
it.
no, that's Therabody I think you're thinking
Oh,
of.
right.
But New Face you can get online or in a number of places. The other great home devices, and particularly during COVID, were home IPL devices for hair removal.
Yeah, that's such
If
a
you've
good point.
already had laser hair removal and you need to quickly just top up your underarms or your legs or anything like that, they're also super useful, again, provided you use them.
Yeah.
So depending on your budget and, the issues that whoever you're buying for has got, they can actually be quite useful on the caveat you use them.
Agreed. And I'd also add to that all of the sort of holistic facial devices as well, things like gouaches, like jade rollers. You don't have to be a sort of wannabe dermatologist or aesthetic doctor, sort of with your energy-based devices. You could just use something just to sort of get the skin glowing and really sort of stimulate the collagen production.
I actually think that just helping someone with their ritual. I really like the jade roller, not because I believe it does anything for my skin, but it gives me time.
Yeah, that's so true.
So you just sit there for a few minutes, and I do not believe it's pushing my products in, but it feels great, and my blood pressure comes down as I'm doing it, and I feel good, and that's significant.
Yeah, exactly.
So giving a friend something like that as a gift of wellness, that's nice.
That's a really nice point. Olga, do you have any thoughts on at-home products, devices?
I've used the derma roller myself.
Really?
Yeah,
That's
but,
punchy.
They're very cheap on Amazon or eBay, but you have to get the very, very small needles, very, very short needles.
Yeah.
So I tried to use them as anti-aging device. Yeah, I think it does do something.
It does a lot, but I tell my patients, close your ears. Olga's a specialist. She's a professional.
Yes.
She's a professional. She knows what she's doing. Don't do this at home. She knows what she's doing.
Very steady hands, I'm
Exactly.
sure. Were there any other questions in the audience? Oh, one at the back. Victoria. Of course you do.
Sorry, just open the Instagram. What's the rule in winter with wearing SPF?
Angeli, do you want to take that one?
Yeah, so I'm actually going to go with my derm hat and say I think we're going totally overkill on SPF.
Interesting.
Now, from a public health messaging, it's really important that people wear sunscreen because it's going to reduce your risk of skin cancer.
Yeah.
But we also have to bear in mind that we are at a very north latitude. Between the months of October and March in the UK, we do not get enough UVB, the ray that will burn your skin, which is why we recommend vitamin D during that time of year, because you require UVB to make vitamin D in the skin. So if there's not enough UVB around to make vitamin D or to cause burning, you're not going to get sunburn. Now, I'm going to caveat that because it's never as simple as yes or no. But what I will say is if you have got a job where you work outside and you're outdoors all day, if you have got an issue where you have got, say, darker skin and you've got issues with hyperpigmentation, those are very, very different scenarios to does the average person that goes to work in the dark and then comes home in the dark when the clocks will change in 2 weeks' time need to rigorously wear an SPF 50 every day? I would argue that you don't.
That's a good point.
The other thing that I would say, and we don't talk about this a lot, but there is a condition called frontal fibrosing alopecia, FFA. And FFA was first recognised in the 1970s in Australia, and it occurs most commonly in Caucasian women where you get hair loss, which marches slightly backwards on the scalp, and you can get loss of the outer third of your eyebrows. And one of the reasons why we think it may occur is it may be related to chemicals in sunscreen use, because Australian women have
That's
been
why it's
wearing
in Australia,
sunscreen
of course.
for decades because of the way that they've been looking after their skin. So I actually think, and this is my kind of general rule on everything, is you can have too much of a good thing. So you have to look at your lifestyle and you have to actually tailor things to what it is you're doing. If you are literally, working outside, you're a builder every day, absolutely wear that sunscreen. But if you know you have literally gone to work in the dark and come home in the dark, I'm not sure you need a factor 50 every day. And I can tell you, as a dermatologist, do I wear factor 50 every day in the winter? I absolutely do not.
Do you not wear it at all, or do you wear an SPF 20, or do you use a moisturiser that has an added SPF or something so there's a little bit of SPF going on?
So for me, because I do go to work and there is very little sunlight in the winter months and I don't have issues of hyperpigmentation, I've got a factor 20 in my tinted moisturiser in the winter, and that's all I would
And that
use.
does you. Interesting. I might take a leaf out of your
I'm the
book.
direct opposite.
Interesting.
So most of my patients come to see me with, and I completely respect Dr. Anjali's master. She does everything that she says is 100% correct for her. But my patients all have hyperpigmentation.
Oh, really?
Hyperpigmentation, melasma, and if you have wearing factor 50, I think wearing sunscreen in the winter, I think if you're wearing it only because you're worried about burning, I think by that token, black people shouldn't even wear sunscreen. But for me, in my patient population, I think it's really important that we also know that there are other reasons why you wear sunscreen: to reduce melasma, to prevent hyperpigmentation. And almost all my patients, including myself, never wears it properly. So
As in they're not using the correct amount?
not using enough.
Because we're is it something like 2 tablespoons or something you're supposed to apply
Exactly, a teaspoon.
It's still a lot.
It's a lot. It's a lot of sunscreen. And wearing that every single day, most people don't do it.
100% they don't.
So for all of my patients who are watching, please keep wearing a sunscreen.
Yeah.
Please wear factor 50 every day, because of if you have a medical condition, or if you have skin of color, if you have hyperpigmentation, if you have melasma, do wear it. If you're going to work in the dark and you're coming home in the dark, of course you absolutely don't need to wear it, because you don't need to wear sunscreen at night.
Yes.
What
You're going to say something.
I will. I'm going to add, though, that we know that with hyperpigmentation, the issue is UVA and visible light.
Yes.
SPF is UVB. So you can wear a factor 30 with high UVA1 and HUVR protection and still not need a factor 50, even if you've got black or Asian skin.
Yeah.
So I think it's also about not everyone needs a factor 50.
Definitely. So UV, what we're discussing here is the difference between UVA and UVB and SPF. So UVB, if we say a factor 50, we're only actually talking about UVB. We haven't talked at all about UVA. If you look on your SPFs, you'll see a PA factor, and it's a PA 1, 2, 3, and 4. This talks about your protection on UVA. And then we have visible light. So when we talk about using a broad spectrum, it's not necessarily the factor 50, that's just UVB. It's about making sure that we're using a broad spectrum that has UVA coverage, UVB coverage, and visible light coverage as well.
Do you both have SPFs that you recommend? I don't know if you're allowed to sort of talk about brands or not. What would be the ones that you both love?
I love so many. So for people that have oily skin, I love the Eucerin Oil Control. People that have dry skin, I love La Roche-Posay and Thelios. People who love mineral sunscreens, we talked about mineral sunscreens and how if you're worried about things like FFA, frontal fibrosing hair loss, you'll move towards mineral sunscreens. And that's the VI Derm and the Murad City Skin.
You're just amazing. Anjali, what about you?
So if I'm worried about hyperpigmentation, I will go for something that's iron oxide containing. So I think an iron oxide tinted sunscreen is really, really important in that context, because it is that synergistic effect that you get from these two specific wavelengths of light that can affect skin of colour specifically. If it's rosacea, psoriasis, eczema-prone skin, I quite like mineral sunscreens. So the one that I like is the Jan Marini Physical Protectant. It's a tinted one, sits quite nicely. For oily, acne-prone skin, I love the Heliocare 360. That's the one that I tend to use every day. So definitely, again, we'll mix and match depending on the issue of concern. But I am quite relaxed about winter months. And if one needs it.
Olga, just to throw into the SPF conversation.
What do you like?
What do you use?
I wouldn't remember the skin brands now, but yeah, my dermatologist suggested, because I do have issues with pigmentation, that I wear SPF 50 all the time.
Well, I'm going to be taking a leaf out of all of your books in different ways. Be very politically correct about it. Well, thank you, ladies, so much, because that was really, really eye-opening. I think what all of you individually sort of spoke about was very much this bespoke, personalised approach to whichever skin condition we're sort of manifesting with, whether we're addressing it as a dermatologist, as an aesthetic doctor, or as a nutritionist. So really relevant information, and a huge thank you from me. You've been an amazing panel, and a huge thank you to everyone in our audience. You've been absolutely fantastic. Thank you for the questions. Our amazing ladies will be here a little longer, I'm sure, if you do have anything else to ask them. But yes, thank you. Come to our next event. It's on the 7th of November. It's all about menopause management. Hope to see you there, and in the meantime, thank you. Have a lovely evening.